Hello everyone. For this topic, we'll be discussing on the pathogenesis of parasitic disease. And when we say pathogenesis, this is the process by which a disease or a certain parasitic disease or parasitic disorder develops. So here we'll be tackling on the general principles on how parasites would cause disease and eventually result into its clinical manifestation. And the pathogenesis in this topic will be the approach here is to give you an overview of the general process on how these microorganisms and the several risk factors in the host that will tend or that will increase the chances of developing diseases. So these are the required readings. We have chapter 1 from Belisario, Chapter 1 from Zabig, practical clinical parasitology, a practical approach, and Chapter 1 from Sastry. So here we have a trigger case. We have a 38-year-old woman presented with severe anemia, chronic pelvic pain, dysuria, hematuria, and urinary obstruction. She is from a village in the Niger River Valley where Schistosoma hematobium is endemic. The patient was HIV negative. The clinical examination and computed tomography scan revealed an invasive bladder tumor. Surgeons decided to perform surgical treatment. During the course, they discovered a malignant bladder tumor invading the uterine cervix and the anterior vaginal wall. They decided to perform a biopsy as the tumor is beyond the bladder, thus not resectable. The histopathologic analysis showed a well-differentiated and keratinized squamous cell carcinoma invading the muscularis propria and serous layer of the bladder. Tumor cells are atypical and abundant eosinophilic cytoplasm, the regular nuclei and conspicuous nucleoli, with many mitosis and keratin whorls. Within the tumor, many schistosoma hematobium calcified eggs are seen with their characteristic terminal spine. Unfortunately, the patient died weeks after before the chemotherapy prescription. The patient died from severe anemia, cachexia, and loss of appetite. Now, this complicated case is a product of the pathogenesis of schistosomiasis, specifically caused by Schistosoma hematobium. Now, we have several species of schistosoma, but Schistosoma hematobium particularly causes bladder schistosomiasis. It causes cystitis or the infection of the urinary bladder. Now, being infected with the schistosoma hematobium in the bladder will pose you at risk of developing urinary bladder cancer, in which our patient developed from it and she succumbed to death for it. As you can see here, the patient had anemia. When you say anemia, the strict definition of anemia is hemoglobin less than 12 grams per deciliter that result into that can be potentially be the result for this one is due to blood loss, since this patient presented with hematuria, which is the urination of blood. The frequent urination of blood poses a risk for developing anemia. So, in order for us to fully understand how all the clinical manifestation of this patient develop, we have to understand the pathogenesis of parasitic diseases or any type of infection or any type of disease. The pathogenesis is the process by which a disease or disorder develops. It can include factors which contribute not only to the onset of the disease or disorder, but also to its progression and maintenance, according to Hogan in 2009. Now, parasites can cause damage to humans in various ways. The first one, it can be through mechanical trauma. The mechanical trauma, it refers to damage of the physical damage of any part or any form of the parasite towards the host. That is mechanical or physical trauma. Now, a very good example of a mechanical trauma is exemplified by the eggs. Now, trematode eggs such as Schistosoma mansoni, Schistosoma hematobium, the one that is presented of the case, can be deposited inside the tissues. Specifically, if it's Schistosoma hematobium, it is deposited in the urinary bladder or the epithelial lining of the urinary bladder. So it can result into mechanical trauma to that part of the urinary bladder, thus exposing the blood vessels beneath it, resulting to hematuria or blood in urine. Now, Schistosoma mansoni can also the eggs of Schistosoma mansoni can also be deposited in the intestinal mucosa. For Paragonimus, that causes paragonimiasis, it is deposited to the lungs. Fasciola hepatica can be deposited to the liver and can cause mechanical irritation, mechanical damage to the tissue, resulting to loss of tissue. Now, larva can also be a source of mechanical trauma. It is exemplified by the migration of several helminthic larvae. Now, as what I've previously mentioned, helminths have three basic forms. It can be in an egg form, can be a larva, or can be an adult. So the usual sequence is from egg to develop into a larva, then a larva develops into adult. For larva, it is notable that they can easily migrate. So for hookworms, Strongyloides or Ascaris, they can migrate through the lungs, producing traumatic damage of the pulmonary capillaries, leading to pneumonitis or the inflammation of the lungs. Adult worms can also cause mechanical trauma, example of which are hookworms, Strongyloides, Ascaris, or Taenia, where they get adhered to the intestinal wall and cause mechanical trauma. Space-occupying lesion can be one way wherein parasites can cause damage to the host. Now, certain parasites produce characteristic cystic lesions that may compress the surrounding tissues or organ. Examples of this is the neurocysticercosis caused by Taenia solium, or it can be caused by the dog tapeworm. Okay. Now, inflammatory reactions can also occur. Now, most of the parasite induce cellular proliferation and infiltration at the site of their multiplication. Now, enzyme production and lytic necrosis can also occur. Now, some obligate intracellular parasites of man produce several enzymes which cause digestion and necrosis of host cell. Now, when we say necrosis, it is the destructive cell death of a certain mammalian or human cell. It is in contrast to that of apoptosis, which is the programmed cell death. Now, necrosis it is a type of cell death that is very erratic. It exposes the intracytoplasmic contents towards the surrounding environment of the cell. So that is necrosis. It is usually a pathologic type of cell death. When you say pathologic, an abnormal or a disease-causing type of cell death. Okay, so a very good example of this enzyme production and lytic necrosis can be exemplified by the Entamoeba histolytica. Entamoeba histolytica is the main causative agent of intestinal amoebiasis. Now, Entamoeba histolytica produces the enzyme cysteine proteinases. This cysteine proteinases they are known to have an interleukin-1 beta converting enzyme activity. Now, what are the roles of these enzymes? Now, the cysteine proteinase, if the cysteine proteinases of Entamoeba histolytica, they actually promote gut inflammation or gastrointestinal tract inflammation and tissue damage. Okay, they can cause erosions of the intestinal lining when we ingest Entamoeba histolytica. That is why they are capable of invasion. They can invade through the intestinal wall and can potentially migrate through the portal vein and can eventually reach the liver. So that is one of their ways to invade the intestinal lining, the presence of cysteine proteinases. Now, what about this interleukin-1 beta converting enzyme activity, or ICE? Okay. Now, interleukin-1, just for the information of everyone, this is a cytokine. Okay, this is an inflammatory cytokine that is usually expressed or that is usually produced in times of infection or inflammation. Now, interleukin 1 is also a cytokine that is responsible for the formation of fever. Okay, so interleukin 1 is a cytokine type that produces fever, or also known as pyrogens. When you say pyrogens, these are substances or cytokines that can promote fever production. Okay, so interleukin 1 produces fever. Now, for Entamoeba histolytica, they have this interleukin 1 beta converting enzyme. And according to this study by Zhang and Wang, this interleukin 1 beta converting enzyme activity could contribute to the intestinal inflammation by activating human PIL-1B released by damaged intestinal cell. These results demonstrate for the first time that amoebic cystine proteinases are in conjunction with interleukin 1 beta converting enzyme to promote further damage, especially in the intestinal lining. Now, another type of infection that can be exemplified by the space-occupying lesion is neurocysticercosis. So what I've previously mentioned, neurocysticercosis is caused by Taenia solium. And neurocysticercosis, this is the most frequent parasitic infection of the nervous system, specifically in the brain. Now, most lesions of neurocysticercosis are intracranial, meaning they can reach to the brain. And what is unique about our brain and the skull is that the brain is enclosed in a space that is rigid. Okay, if the pressure inside our skull increases, there is no way for our skull to expand, especially if we are adults. There's no way for our skull to expand. So it's always constricted to that structure. Now, if there is a space occupying lesion, or if you add pressure, if you add matter inside the skull, the pressure will eventually accumulate, in that it can result now to hydrocephalus. Okay, and hydrocephalus is the accumulation of fluid inside the cranial vault. Okay, now hydrocephalus, in this case by Amelot and Philot, they reported a case that hydrocephalus was related to intracranial neurocysticercosis. Okay, and that the hydrocephalus was due to an extensive arachnoiditis to the craniocervical region. Now remember that we have several layers of the meninges of the brain. So we have the pia mater, which is the innermost, the arachnoid mater, which is the middle, and the outer is the dura mater. Now, the parasite cysticercosis or the Taenia solium can be deposited in one of the it can be deposited in any of the structures of the brain, even the meninges, and it can also potentially obstruct the flow of our intracerebral fluid. Okay, so, or the cerebrospinal fluid. We have the cerebrospinal fluid in our brain, and if a parasite can potentially block the flow of the cerebrospinal fluid in the brain, it can result into an obstructive type of hydrocephalus. Okay, so these cases are very good examples of space occupying lesions that will result into disease. Now, toxins can also cause damage to humans. Now, some parasites produce toxins which may be responsible for the pathogenesis of disease. Allergic manifestation, and because many metabolic and excretory products of parasites get absorbed in the circulation and produce a variety of allergic manifestation in the sensitized host. Okay, a good example of this one is the dog tapeworm, the Echinococcus granulosus. Now, if the Echinococcus granulosus, they would usually exist cyst-like form inside our body. They can form cyst. They can form cyst. They can form cyst inside the liver, inside the brain. Okay, or they can also form cyst in the spleen. Now, if these cyst becomes ruptured, what will happen is that the antigens of parasites can promote allergic reactions in the body and can potentially result to anaphylaxis. Now, anaphylaxis is a deadly type of hypersensitivity reactions characterized by hypotension, severe bronchoconstriction, formation of rashes, and even gastrointestinal problems. So it can potentially result to the death of the individuals. So that is one way of how parasites can cause disease and death through allergic manifestations. Now, neoplasia can also cause damage to humans, and parasites can cause neoplasia. Now, when you say neoplasia, it means new growth. Now, neoplasia is divided into two. They can be when you say neoplasia, these are uncontrolled abnormal growth of cells or body tissue in the body. Now, neoplasia can be divided into two. They can be benign or they can be cancerous. Okay. Now, what was presented earlier in the trigger case is a case of Schistosoma hematobium that resulted to neoplasia or the cancer of the bladder. So examples of parasites that would result to cancer as the one that we have previously mentioned already, Schistosoma hematobium. And aside from that, we have Clonorchis and Opistorchis, which are examples of trematodes that can cause cholangiocarcinoma. Now, what is this cholangiocarcinoma? The cholangiocarcinoma is the cancer of the gallbladder or cancer of the bile duct system. Now, very common also is that parasites can also promote secondary bacterial infections. Now, some helminthic diseases can also promote secondary bacterial infections such as schistosomiasis and strongyloidiasis. Okay, so in this case report here we see that chronic infection by Schistosoma hematobium sometimes lead to serious complications such as bladder cancer. And schistosoma associated bladder cancer has characteristic features. They can produce squamous cell type carcinoma of the bladder, younger age, and advanced clinical stage with poor chemotherapy outcome. And eradication of the parasite remains the only efficient way to prevent the devastating consequence of this parasite infection, such as bladder cancer. So that is why, aside from the genetic and environmental factors, we have also taken into consideration the infectious causes of cancer. Now, there are several types of cancer that is caused or that is wherein infection can be a contributory, not necessarily cause, but infections can be contributory. Now, schistosoma hematobium is a very good example, and other types of infections such as viruses can pose a risk factor for developing cancer. Examples of which are the Epstein-Barr virus. They can potentially cause lymphomas or the cancer of our lymph nodes. In terms of the effects of the parasite on the host, there are several mechanisms in which parasites can cause injury to the host, and basically this is just a summary of what we have mentioned. But the most common mechanism of the parasite on the host is the production of parasitic enzymes. Example of that is the one that we have previously mentioned, is the cysteine proteinases produced by Entamoeba histolytica. Another mechanism is through invasion and destruction of tissue host, and parasites can also deprive the host of essential nutrients and substances. Now, what is also important here is what is the effect of the host on the parasite. Now it's the other way around, not the parasite to the host, but the host on the parasite. Now, the genetic makeup of the host may influence the interaction between host and parasite. If you are more prone to infection, then you are basically welcoming parasitic infection. So if you have primary immunodeficiency diseases, you are more prone to developing all sorts of infection, including parasitic infections. Now, very important is the nutritional status of the host. Protein-rich diet is not suitable for the development of intestinal protozoans, while low-protein diet favors the appearance of symptoms of amoebiasis and complications of the disease. Now, some high-carbohydrate diet favors development of some tapeworms such as Taenia solium and Taenia saginata. And very important also, the immune process play an important role in the host-parasite relationships. So if you have a poor immune response, then you're more promoting the growth of the parasite. So that is why in patients having HIV or human immunodeficiency virus, if they are infected with HIV and if their viral load is too high and their cluster of differentiation 4 or CD4 cell count is very low, they are at risk of developing parasitic diseases. Okay? Now, I would just like to emphasize that just like to emphasize that it doesn't mean that if you have HIV infection, you are already at risk of developing these opportunistic infection. Or if you have HIV, that doesn't mean that you have also AIDS. So very important to note is that in HIV, the HIV viral load and CD4 count really matters. Okay, so in those individuals who are not well controlled with their HIV load and CD4 count, they are more at risk of developing parasitic infection, specifically Pneumocystis jirovecii and Cryptococcus meningitis infection. Okay, and some of the parasitic infections such as Cryptosporidium parvum. Okay, so that is important also. That's why I'm telling you, it is an interplay of host factors and parasite factors.